The History of Primary Care Medicine by the London School of Health. Thank you for joining me. My name is Terry Furlow. I am a career physician of internal medicine and have cared for patients in emergency departments, hospital wards, critical care units, and primary care medical offices. Primary care medicine is the specialty dedicated to providing fundamental health care. I've consistently enjoyed my work helping adolescents and adults to develop and maintain better health. Over many years, I've organized my medical knowledge, experiences, clinical skills, and research of high-quality medical publications to create the Health Maintenance Handbook for adolescents and adults in primary care medicine. I founded the London School of Health to promote this work and to assist medical professionals in delivering optimal healthcare services. Please journey with me now to gain a deeper understanding about the history of primary care medicine. Let's start by looking at the structure of a complete healthcare system. Primary healthcare refers to essential office-based healthcare services, which are available to all people within a community. Physicians, registered nurses, and often nurse practitioners are the clinicians working in a primary care medical office. Basic specialty certifications are available for clinicians in pediatrics, family medicine, and internal medicine. Optional subspecialty certifications are available in neonatology, adolescent health, women's health, and geriatrics. People visit a primary care medical office by appointment during business hours, but a walk-in clinic may also be available. Emergency medical guidance should be available 24 hours a day, 7 days a week, 52 weeks a year. Patients receive comprehensive evaluation and treatment, and collaboration with secondary and tertiary healthcare professionals. Secondary healthcare refers to other outpatient services, such as imaging procedures, focused specialty care, emergency care, and childbirth. Tertiary health care involves inpatient hospital services, where medical and surgical specialists evaluate and treat patients 24 hours a day for high-risk conditions until the patient can return to outpatient care. Most hospitals provide general care, but some specialized in children's care, advanced cancer care, or another type of specialty care. For completeness' sake, ordinary health care refers to clinical medical research and experimental treatment. Perhaps the best definition of primary care comes from the American Academy of Family Practice. It states that primary care is the provision of integrated, accessible healthcare services by physicians and their healthcare teams, who are accountable for addressing a large majority of personal healthcare needs, developing a sustained partnership with patients, and practicing in the context of family and community. The care is person-centered, team-based, community-aligned, and designed to achieve better health, better care, and lower costs. There's also a second paragraph with more details about the scope of primary care medicine. Two interesting definitions are published by the United States Center for Disease Control and Prevention, which is often referred to as the CDC. The first states primary care providers include primary care physicians, physician's assistants, and nurse practitioners. Note that the word provider is a newer healthcare term. It refers to a clinician who is licensed within a certain jurisdiction to take medical histories, perform physical examinations, order laboratory testing and imaging procedures, making consultations with specialists, and then arriving at diagnoses and prescribing treatment. The second definition states primary care physicians are those in family and general practice, internal medicine, geriatrics, and pediatrics. I would contend that during the 21st century, there are very few physicians who could declare themselves as a general practitioner and truly be competent to practice primary care medicine. "1978 was the watershed year when the World Health Organization published the Alma Ata Declaration. It states that health is complete physical, mental, and social well-being, not merely the absence of disease or infirmity. It's a fundamental human right and an important worldwide goal. Primary health care is essential health care, using practical and scientifically sound methods, socially acceptable services and technology, accessible to everyone within a community at an affordable cost. Primary health care requires a community spirit of self-reliance and self-determination. There must be community social and economic development to build and maintain a primary care medical office, which should be nearby where people live and work, and participate in secondary and tertiary healthcare services. The Declaration pointed out that there were gross inequities throughout the world between developed countries and developing countries, and even different settings within a single country. This is certainly true within the United States. The Alma Ata Declaration made a prediction that acceptable health care should be available to all people of the world by the year 2000, with full and good use of all resources. This did not come true and certainly is still not foreseeable. But they noted that resources should not be spent on armaments and military conflicts, but a genuine policy of independence and peace, a devotion to peace and social and economic development. 3 years later, in 1981, the textbook Primary Care Medicine was first published. This is still a highly regarded healthcare resource with in-depth clinical information. It supports medical decision-making. It's mostly problem-based for a variety of illnesses and injuries, and it has strategies for evaluation and treatment. The 8th edition was published in 2020 at over 1,600 pages. More than 95% of the text is written for problem solving. There's little focus on the goal of health maintenance, and only a few pages dedicated to adolescent health. Let's turn next to the essence of primary care medicine as it really evolved in human history. The best evidence suggests that 4 centuries before the Common Era, Hippocrates set the groundwork for primary care medicine. The fundamentals of Hippocratic medicine are high ethical standards, patient-centered care, medical history taking, physical examination, and finding the cause of illness. It states that good health requires good nutrition, physical fitness, good hygiene, when necessary, wound cleaning, and using medicinals to treat disease. But there's no surgical treatment. This is part of the Hippocratic Oath. There's a focus on women's health and childbirth, and there are careful medical records and health education. Hippocrates was famous for using aphorisms to teach. Our understanding of health and disease improved over the next 2,000 years. Many effective treatments were identified and even strategies for prevention. But there was no sustainable primary care medicine practice anywhere in the world until 1911, when the British National Health Insurance Act was founded. This provided a British general practitioner, the forerunner of a primary care physician, to all British citizens on the purchase of health insurance. Please note that during the 20th century, the United States general practitioner was very different. These are physicians who hang out their shingle and perform any medical or surgical procedure they choose to do. Unfortunately, it's the court system that provides quality assurance after the fact. But in 1933, the American Board of Pediatrics and 1936, the American Board of Internal Medicine were founded to set high quality standards for treating children and adults. These certifications remained optional through much of the 20th century, but they did gradually improve the quality of healthcare in the United States. After World War II in 1946, the British National Health Service Act was passed, providing a British general practitioner to every British citizen. The 1960s was the main decade of progress in the United States. In 1968, the United States Society of Adolescent Health and Medicine was founded. Eventually, there were certifications from the American Board of Family Medicine, Pediatrics, and Internal Medicine. Since that time, adolescent health has improved in quality, but it's still mostly spotty throughout the United States. In 1969, the American Board of Family Practice was founded. It eventually changed its name to the American Board of Family Medicine. They realized that practicing primary care medicine, routinely taking out gallbladders, setting orthopedic injuries, and delivering babies was not a good practice style. At present, there is still no primary care medicine specialty certification for clinicians. Let's finish up this discussion with a timeline of primary care medicine specialty in the United States. We've already discussed 1978 in the Alma Ata Declaration, 1981, the textbook Primary Care Medicine. During the 1990s, there was a failed plan by insurance companies to require referrals from primary care medical offices for specialty care, especially surgery. The insurance companies and no one else in the United States was really interested to support primary care specialists to do this. In fact, by the year 2000, the federal government with Medicare and Medicaid and private insurances started reducing payments for primary care services. By 2005, concierge medicine surged in the United States. These were highly qualified physicians who realized the only way they could stay in practice was to close their population, charge a set amount each year for a patient just to be in the practice, and then charge for services on top of that. By 2010, the United States had essentially bankrupted high-quality primary care. In 2015, mid-level providers surged in primary care. These are nurse practitioners and physician's assistants with little or no collaboration with physicians and healthcare teams practicing primary care medicine and now provide a significant percentage of services in the United States. In 2022, U.S. funding of primary care was shown to be about 25% per patient compared to Britain and Western Europe. During the 21st century, United States healthcare statistics were generally worsening. There were improvements for treating specific diseases, but overall, much of our statistics were much worse than Western Europe. In 2023, the Commonwealth Fund, a century-old American non-for-profit that studies and promotes good health in the United States, published their healthcare affordability survey. It looked at 6,000 working-aged adults over a one-year period of time, and they were divided into four groups: those with employer-provided insurance, those with privately purchased insurance, those with Medicaid, and those with Medicare. The survey found that about half of the patients in each group had difficulty affording health care, and about a third of the patients in each group said that debt caused delays and avoidance in choosing healthcare services. and that these delays were causing increasing illness. And so in the future, how will the United States reverse its downward spiral in the quality of primary health care? Thank you for your time and interest. To learn more about excellence in healthcare, view the other video by the London School of Health about the future of primary care medicine.